I'm always concerned about people's health. And so when we see something like in this case where we see breakdown in the gum tissues and in the teeth, is something else going on systemically. So sometimes that's an entree into having that discussion of, is something else going on? And if it is, maybe we work on those things and it can lead to healthier things. Because if somebody's unhealthy and you do work, if they stay unhealthy, that work's not going to get any better. The same thing if they have a bad bite and we make the teeth to fit to the bad bite, we're not going to get anywhere. So we want to try to move forward. So my discussion with patients are always, I don't tell them that they have a problem. I have the discussion and let them tell me what their concerns are. People can have diabetes. They could have different types of autoimmune disease that can cause gingival problems. They can have imbalances with vitamins, vitamin D, vitamin B12. All of these can be something that gives us a clue to what's going on in their mouth, as well as other types of rare or strange disorders, blood dyscrasias, leukemias. These types of things can cause something that we actually see it in the mouth. And one of the things that we always say in our practice is that the mouth is connected to the rest of the body, which sounds silly, but people don't realize that a lot of times you pick up systemic illnesses, the first clinical signs are in the mouth, and because we see our patients at least twice a year, we have a better chance of picking those things up. We need to do what's clinically appropriate. So we have a patient who comes in when they have very deep pockets, they have bleeding on probing, they have basically, for lack of a better word, pus that comes out around the gums. That's not healthy. That's bacteria that's in there, and it's not something that they're able to take care of themselves. So that is going to be a problem where they can lose teeth. They may have other systemic types of problems, and we need to get involved and do something about it. And so we come up with a plan of the best way to move forward. So this is a conversation that had been going on for some time, but with the patient, we walked in, she was in again for our routine visit. Our routine for her was a little bit more often. And on those recall visits, we said, we're not seeing improvement in our basically conservative treatments, which were scaling and root planing, basically medication types of procedures. And so we said we need to do something else. And on top of it, we needed to, in order to do these things to make things healthier, we could get a much better aesthetic result as well. So with this case, we found out or realized that it's basically a localized type of problem, where it's in a gingival type of problem, and what we needed to do was to reduce the pockets. So people, when they have pockets, it means that the gums are high up here and the bone is down here. And what happens is once you get past a certain level, the bacteria change from being aerobic, meaning liking oxygen, to anaerobic, and that's when they become very destructive. You lose more bone and you get more of that gum problem. So people say, my gums bleed all the time. I can't seem to get them to stop bleeding. And sometimes it stops people from flossing their teeth because it bleeds so much. And what you really need to do is you need to get things clean. The problem is that our patient can't get down all the way to the bottom of that pocket. So again, we do something where we do surgery to remove the pocket, remove the tissue that doesn't belong, clean things up, and basically let the tissue heal, and then now we have something to work on. In this case, we needed to extract a couple of teeth and then make a new bridge, and the overall result was healthier and looked better. Yeah, patients have that problem. It's interesting because people do different things about it, and you'll see that they'll talk with their hand in front of their mouth, and we have patients that do that. You feel bad because you know that they're not happy about how it looks. They're not happy, showing their friends and their family, and now you don't walk in and say, this looks terrible. You have to be compassionate. You have to understand why people have this type of problem. What can we do about it? And so I always look for, there's always options, right? So if you're not happy with the look, this is what option A is, option B, option C, option D, and then how do we do these things so that it feels good for you and we get the healthy and better looking result. The other options would be to place implants. Implants are great. It's a titanium screw that can be placed into the bone, and then we place a post in that, make a crown over it. It's as close to having your own teeth as having your own teeth. Nice part is you don't get decay, but you still do have to floss and brush and keep everything clean. So it's not a giveaway type of thing. The other option would be something removable. Something removable is nice because it's a very easy procedure in a lot of ways. It's very conservative. We don't need to do much to the other teeth. The downside is it's removable. And so obviously that comes with different things for different people. And sometimes it's a combination of implants using regular teeth and putting all different pieces together. And again, it's an individual thing. Everybody's treatment is different, and we need to try to figure out what's best for our patient. When a patient comes in and there's apprehension about it, that's why we do our planning process. That's why I take pictures. That's why I do wax-ups. I go through what the entire procedure is going to be, from this is what's going to happen, this is what's going to happen, this is what's going to happen, and then this. The reason that we have fear, in my belief, is because we don't know. We don't have knowledge of it. So if we give patient knowledge, it empowers them to not be afraid, because now they know, yeah, this is what's going to happen, this is what's going to happen, and this is what's going to happen. And that happens through planning and then follow through. I just talk with my patients. I try to get to common ground of where we're at. I joke around also, and try to make it not as serious as people always fear. I mean, the worst thing is going to a dentist, because what do we have? What do we tell people not to do? Don't put anything sharp in your mouth. And what's the first thing we do? We put something sharp in your mouth. So getting over that is one of the important things. Having that discussion, showing the patient that you care about what happens. And that's what's nice about all the people who work in our office, that they really care about our patients. From the first appointment till when we finished, it's roughly 6 weeks. And that basically the first appointment is the toughest appointment, because we needed to extract 2 front teeth, which I give this patient so much credit for, because you're going from a thing where we're basically removing teeth and saying, she's putting her trust in me so that we can move forward. And that makes me, it's important for me to really make sure that we get the best out of it. I mean, if you can imagine what it's like to be missing your front teeth. And then what we do is we make a temporary bridge, we do our surgery at the time, we let things heal, we make sure we're getting the healing that we like, and then we go on to make the final prosthesis. When we look at a comprehensive case, there's a bunch of things that come in, and we talk about joint problems, your temporomandibular joint. We talk about whether patients have sleep apnea, whether they grind their teeth, whether they have other types of parafunction. It could be moving their jaw side to side, chewing on different types of things. And we need to take all of that into account when we're going to make the new restorations, because if we don't, we're going to be in a similar situation that the patient is and we're now being treated for.